How old were you when this song came out? Now calculate and do the difference. Welcome back to the show. It's the AM Club on MX24 TV. Throwback Thursday. You see why I love Throwback Thursday. Thank you so much for that, Chichi. Let's have more important conversations, like oral contraceptives, okay? A conversation that is important for especially young men out there. MFI is looking at me weirdly, but I don't care. We have Dr. Louisa Ademki-Mate. She's a public health physician specialist and municipal director of health, Ayawaso West Wogon. Of course, we know her on the show, not a new face. Good morning.
Good morning.
It's always have you on the show.
Yes, it's always a pleasure for me
They're
too.
taking the topic very personal.
Really?
If this was yesterday, you'd have been marching. The green color.
Yes,
Ah.
Very nice.
it looks really good on you.
Thank you.
Okay.
Doc, frequently asked questions.
Doc, ask him what he thinks oral contraceptive is.
You're going to test my knowledge on TV.
No, have you seen it
Maybe let's
before?
start with contraception.
Contraceptives?
Yeah.
Okay. Yeah, they are pregnancy control methods, aren't they?
Oh, I like his answer.
Yeah.
It's
Yeah.
fantastic.
Yeah.
So maybe just to add a bit, so it's artificial, first of all.
Right.
Yes. So we go with artificial methods or techniques to control pregnancy as a consequence of sexual intercourse.
Okay. Artificial, so it means there are natural ways too?
Oh yes, there are natural ways. There's fertility awareness methods, what people call
Free
coitus
period
interruptus.
you remove withdrawal.
Yes, or you know your cycle very well.
So you know that there's the grace period where you are allowed
Exactly.
to
And then
engage.
you use you.
Those are the natural methods.
Yeah, those
What
are
did
the-
you
Those ones, they say, we know them. Those ones, we know them.
It's what you think with
it's
their
about using
plants.
it correctly
It's
and
about doing-
consistently. Because sometimes you get carried away.
But does it always work, the natural methods? Because
If
someone
you
will tell
use
you,
it well, you know the cycle well, and you use it well, it works.
it's not possible for someone to still get pregnant during their grace period.
You see, the thing about the human body is that you cannot predict it 100%. And it's the same situation even with the artificial methods. They are not 100% effective.
Okay.
I mean, you can have 99% and things like that, but there's still that 1% chance. And that's why there's always a God factor.
Yami waho. Doc, let's explore. I mean, we are focusing on oral contraceptives today,
Right.
but for a little education, let's explore all the natural methods that there are for my brothers and I. So there's the pull out, there's the knowing the ladies.
Is that a medical term for it?
Coitus interruptus.
Ah.
So
Coitus interruptus.
Yes, you interrupt the
coitus.
at the point where you would have to, the man is ejaculating. So introducing the sperms into the vagina. That is at the point that you interrupt. Then it means that the sperm doesn't get to the ovaries.
Sometimes during the intercourse, the men feel that there's a setting ejaculate, not the main one. There's what I think they call the pre-cum that happens during sexual intercourse. So the man has not come, but you know that certain things are coming out of the penis. Can that impregnate a woman?
Yes, if once there's a slip of a sperm in there, you can impregnate a woman. So that is why we always say, why don't you rather use a barrier method? Because once there's a barrier, like the condom, you know that pre-cum doesn't get there, the sperm itself doesn't get there, plus the added benefits of protecting you against STIs. So if you ask me, I would say go for that barrier method and do it more consistently. I'm saying this because I'm a public health physician, because I'm looking at the bigger picture. You want to prevent pregnancy, but if you are in a mono sexual relationship, you are sure that this is the one person I'm with all the time, and both of you have tested for HIV and STIs and you are okay, then you can take such risk and go ahead and say, why don't I try natural methods and things like that. So the method you choose depends on your reproductive needs, your relationship needs as well. Because, I mean, there are different kinds of people with different kinds of open relationships and that sort of thing. You're not sure whether you're the only person and that sort of thing. So we need to be guided a lot in using more than just one factor about preventing a pregnancy to decide on the contraceptive methods we choose.
The coitus interruptus, this is highly dependent on the man, or how much can the woman be part of this process?
It's highly dependent on the man. It's highly dependent on the man because, well, if you've been with somebody for so long, sometimes you know when they are coming.
Yeah.
Yes, I mean, naturally. But if, I mean, somebody new, you probably will not know when
I asked this
he's
question.
coming.
This will take us, even though we've been taking the conversation from top, it will take us all around. Some myth about some women thinking that, well, if you're unsure that this man ejaculated in you, people tend to wash with water. People tend to come up with certain, I've forgotten some of the things that they think they can do
and let it
to let it out, and they think that's the sperm coming out of it. And so they think they have a certain control between the man and the woman. Even with the natural method and then the artificial method, it looks as though women have a much higher control over the process, or what?
Well, let me take it from this angle. Sex is a two-way thing. The man, the woman, before there will be a pregnancy, sperms must meet an ovum. So the man has to ejaculate. So I don't see for me, I don't see how I'd say the woman has more control.
Okay.
You know, because once you are having unprotected sexual intercourse and somebody has the opportunity to ejaculate into the vagina, I think that person has more control. I mean, are you going to run away from him, from beneath him on the side? Or, I mean, you know, so I think there's a lot of shared control. But when it comes to depositing the sperms, the man is in a lot of control, short of you having to push him off you and things like that. And of course, they are usually stronger than us. So, I mean, because we need to empower everybody we need the sexual health. You need to be empowered. There must be respect. There must be, I mean, you don't have to feel coerced into having sex. And that discussion must be had one way or the other, because then both are empowered. You know what you want from the beginning. If the man tells you, I don't want kids, believe him. He doesn't want kids.
Yeah.
So you don't go and manipulate a man and get pregnant for him, and then just, you know, if he says he doesn't want it,
He really doesn't.
He really doesn't want it, you know. So we should know that the control is shared. We should know which roles each of us play in making those decisions about our contraceptive life or our reproductive life, and take it forward from there. I think most of our problems in these things, we don't communicate. We assume a lot of things, you know, and then at the end of the day, somebody is feeling a victim because of assumptions.
Are there types of oral contraceptives? Clearly, because I think we know that oral is you taking it.
Yes, so oral is by mouth. There are other contraceptives, but oral just simply implies taking it by mouth. There are the combined ones, and then there are just single ones. So combined oral contraceptives and then single dose ones. The combined oral contraceptives are the ones that are most commonly prescribed by a lot of prescribers. It has the two sex hormones in it, estrogen and progestin.
Okay.
And then there's the other one, progestin only one, which is what you were talking about, that is usually in the emergency cases. So, I mean, a lot of prescribers would rather you do a combined one, which is usually the routine one. But of course, some people also react to some of the agents in it. So if you can't take estrogen, for instance, then you just have to go for the progestin one. So those are the common oral contraceptives that are there. And the commonest one that's mostly prescribed, I said, is the combined oral contraceptives.
When you say combined, do you mean the number of times you take them?
No, it's about the hormones that are in it.
In the pill.
In the pill.
So it could be one pill, but then it has two
hormones in there. Yes. So the estrogen and the progestin is the combined one, and then you have the progestin only ones that are single ones.
Beyond allergies, what would make someone go for the combined and not the single one? And
usually we would prefer prescribing the combined.
Okay.
Why?
Okay.
What's
it doing? Because the hormones are two, like I said, the estrogen and the progestin. They are the natural sex hormones that we have as women. Okay. And so the pills try to manipulate the concentrations of these two hormones, because it's affecting the cycle. what they do is that they prevent ovulation. Once you don't have eggs, then there's no fertilization. And then they also, the cervix is also the route through which the sperms flow. And then the menstrual cycle, as a point of menstrual cycle, for a good flow of the sperms, the cervix becomes thinner, but the hormones, once we introduce more, it thickens the cervix and it prevents the sperms from flowing easily.
Okay.
So that's how it can also prevent the pregnancy. Right. Then the other aspects, the third thing is that the uterus is the one that gets ready to receive a baby. The thickness of the
cervix,
the uterus itself, its wall, must be a certain way to be able to accommodate the baby. So the combined oral contraceptives with those two hormones also affect that, can affect they can thin the endometrium, the wall of the uterus, such that it doesn't allow for proper implantation. You understand? So we use those two so that we can balance out the natural a bit of what the hormones are and what they do within our menstrual cycle to help with pregnancy and that sort of thing. So that's why they usually use those two, so that you have the steps like I've enumerated that way. There are people who have allergies, especially to estrogen. For instance, for a woman who is prone to having blood clots, high levels of estrogen can increase the risk of somebody having such clots. So for somebody like that, you wouldn't actually want to put the person on combined oral contraceptive that has estrogen in it. So depending on the individual and what the individual needs, the clinician would decide that let's go for POP, that is the progestin only pills, or the combined pills. Now to your question about how they are taken, right? You asked the question that is it because of how they are taken?
Yes.
Or
Yeah, is it the...
So it's, I should have probably brought some of the pills, but yeah, next time.
Mentioned something about daily ones and...
Yes, so you have a 21-day one, and then you have the 28-day one, and you have, sometimes you have up to like a 91-day one.
Shishi, let's see if we can get a picture. We can at least get a picture from the internet
get
and then
a
put
picture.
it. Okay.
Yes. So usually most women have a 28-day cycle. Some 21, some 35. But usually on the average you have 21 days. So how the 21-day cycle one runs such that every day you take a pill for 21 days. And then you stop for 7 days. Within that 7-day period, you see your menses. Because we like to see our menses. Only a few women don't want to see it. So if I'm on a pill, I still want to see my menses. Yeah. And it gives you that reassurance that you're
still a normal woman.
Yes. So the 21-day one has that. 7-day stop after 21 days, and then you see your menses within that period. Then there's a 28-day one that you would take the pill for 28 days straight. But the 7 days, there's that 7 days that you wouldn't have taken in the 21-day one, has other pills that are like what we call the medicine placebos. They don't really contain the hormones. So you take them. Sometimes they put iron. Yes, just to support the woman's health. And also, there are some people who are so forgetful. She stops taking it for 7 days, and then she forgets that, the 7 days is over. So to help support people like that, just continue taking it for the next 28 days. The pill box finishes, and then you pick another box and starts all over again. And then there are those who also prefer, so you have that's there. So you start, and then it goes round. And you see the different colored ones on the screen at those periods where you take a break, more or less, like it's a 28-day one. So you're going, and then once you get the yellow or orangey ones, they don't have the estrogens in it, the hormones in it. So you just take them just to support you to remember. And then you just keep taking it. But those 7 days don't really, so that you can see your period.
So you're likely to be in your period at the time that you're taking
the orangey ones.
Right.
Yes. And yeah, you wanted to...
No, because I just realized that I think what most men are familiar with is the emergency ones we're talking about. Because I got confused a bit about 21 days, but I'm understanding it now that this is what you take to control. So you could be having sex during this period and taking these pills.
Exactly.
Beautiful.
Exactly. So just to take you back on the emergency contraception, as the name implies, it's an emergency contraception. When you are on the combined oral contraceptions, you know in your mind that I'm on a contraception and I'm taking it, oral contraception, I'm taking it every day to prevent the pregnancy. You are, again, a matter of control. You are in control. You know that I have deliberately done this so that I won't get pregnant. But in the phase where you are just there, it brings the picture of lack of control, increased risk, because if you're, I mean, people use emergency like 3 times a month. If you have to be taking emergency like 3 times a month, get onto a normal contraceptive, oral contraceptive pill, because you know that you need it. Question is also, it can affect your cycle, because you take it haphazardly, it affects the cycle. Sometimes you get side effects. Sometimes it fails because it's an emergency contraception. You take it, people sometimes take it in vomits and then forget that I have to take it again, and then you get pregnant. And so the control, the risks are higher. And it also gives the impression that you are generally probably a risky person, because if you don't want the pregnancy, then why don't you get onto
You're an
one?
ambulance, basically.
Yes, an ambulance. I like that. You know, so why don't you take control and then do it right? Because I mean, if you like taking oral emergency contraception, it means you're a good candidate for oral contraceptions. I mean, the routine and normal way. So I'd like to discourage a lot of the. I mean, I think what's the problem is that people feel judged, especially the younger ones. They feel judged that they walk into a facility and they say, I want to be on contraception. Somebody's asking, why do you want to be on it? But, I mean, it's an individual thing. You know, some people have to take control of their sexual life, take control of their reproductive life. Because, I mean, life is about decisions. If I don't want a baby at this time, and, okay, my job as a health professional is meeting this young person, it's not to judge them, give them the information they need, so that if your interest as a health professional is that, look, having unprotected sexual intercourse can expose you to having STIs, talk about that. Encourage this person to see how they can still prevent the pregnancy and take control of it. Remember, there are female condoms. We need to empower the women to use the female condoms. Keep it in your purse. If you go for a game and he's not ready, like, look, I have a bag here. I'm pushing the bag there. Just get in there and let's
Or you could
be
also just
empowered.
get it for the man.
Or yes, or
have
carry your male condoms around. He's not ready to use
slip
one.
it on and
Slip it on and
There you
just
go.
and just move with it.
Shall we go back to the daily pill? There's so many myths about it. Some people say that, yes, I'm on it, but I feel like it disrupts my period. Some people also say that I've seen that I'm gaining weight. Some people also say that I've been taking it for a while, and after I stopped, it looked like my body took time to want to reset back to its normal period days and all of that. First of all, apart from these concerns, when the doctor or whoever is supposed to prescribe it, puts you on it, is it doing anything negative to your body at all, aside the benefits that you're getting? Does it ever do anything negative to your body?
That's a tough question to answer, because you see, the thing about medications is that whatever medications you take have side effects. I keep telling people, even paracetamol has a side effect. So once the thing is not natural, you should expect some side effects, and you must be informed about them, know about them, see them happen with you, and then report them for those that you are very much uncomfortable with. Because there are minimal side effects like headache. Some people complain of pain in the stomach when they swallow. Some complain of an increased anxiety. They are just feeling like they are not themselves, getting angry easily. And like you said, some people, I mean, every young people, most of them have a friend who swears that oral contraceptives make them fat.
Yeah.
And things like that. So, you know,
Is it true?
and there's that side effect. There's that labeled side effect of likely weight gain. But you see, we are different individuals. And of course, once you know you are on a pill that could let you gain weight, you need to watch your food, you need to watch your exercise and things like that, because you know that you're on this pill and it's likely to make you gain weight, especially for people who are already weighty. You know, there are people whose weights, there's nothing that can change that weight. They are so controlled in their weights. They eat like anybody else and they are fine. There are people who eat small and then they are gaining weight. So you know yourself, and then you can, look, if I'm on this pill, then I need to put in an extra work to what I eat and how I exercise and things like that. So those side effects
It's
are
not
there.
generally like it comes with the medication, but it is very to the individual person. So there's no doctor
Exactly.
going to tell you that I'm putting you on this pill, but look out for your gain because these are the side effects of it.
No,
You're hardly going to get that. Is it not psychological?
It's an individual thing.
It's not psychological.
It could be, especially, you see, like I said, there are people who will say, I have a friend who said that, or who was not this weighty and then suddenly became weighty. So, I mean, those things are there. And again, it's an individual thing. So if the doctor says, okay, or you ask your doctor, what are some of the things I should expect taking this? And the doctor says so and so, and you ask about weight, okay, so this is my weight at the beginning of this. This is how I eat. This is my diet, blah, blah, blah. I'm doing the same thing. I haven't changed anything and I'm gaining weight. Then you have a point that nothing has changed and I'm gaining weight. But if you follow through and things have changed, you are eating more, you are...
Knowing that you're not going to get pregnant anyway.
Yes, and most people, at the time that they are on oral contraceptions, their bodies are changing. Maybe younger people, they are growing up and their bodies are already changing, or you just had a baby. I mean, there's some weight gain after having a baby and things like that, and then we may associate. So before you associate and associate it well, it means that you must have observed that truly there's nothing else that is explaining this weight gain around, you know.
And we can conclude.
And then we can conclude that that is it. But if you know that there's a small chance that you gain weight, watch the diets, exercise, and then go see your doctor if you think that this is making you gain weight. And there is an individual thing. We can always change these contraceptive medications for you.
Unlike the emergency pills, it seems to me that these ones cannot be bought over the counter. It must be recommended by a clinician, right? A doctor. Because I know that for the emergency ones, anybody at all can enter and say, I don't want to mention certain brands, the popular ones out there. But these ones seem like, because you said for some people they are likely to get blood clots and whatever. So must these be recommended by a doctor?
Yes, we usually advise that before you get onto a proper family planning method, we call it a family planning or contraceptive method, you have to engage a healthcare professional. It doesn't, I mean, for us in the Ghana Health Service, we provide these medications at facility levels. You get it. Once it's in the facility, it's in the hospital, it's in the clinic or a polyclinic. You get there, you talk to a health professional, and then they provide it for you with advice and information so that you can come back for follow-up. But if you buy it off the counter...
Can you buy it over the counter?
I mean, now you can't really get this, over the counter like that. You can get the emergency ones over the counter. And probably that's what is pushing the emergency medication. So, yes, these are policy issues that we have to look at. But, of course, if you want the comprehensive care for the person to be able to come back, to be assessed properly, because other side effects like increased BP and things like that, and you just pick it off the counter and you're having complications, then you come back
to the hospital.
Yes, so I mean, I think it's about empowering ourselves as people, and knowing that your health, including your sexual health, is yours. You shouldn't be intimidated by anybody. I mean, I don't want to go to the facility but I want to go and pick something off the counter because I'm intimidated or feeling...
Should you not easily even have this one rather than the emergency? Because then every time you're buying an emergency, they know that you just had sex.
Exactly. Exactly.
You know?
Exactly. No, it's not interesting.
I think it is.
Difficult to buy
it's an interesting point.
I find it that more men buy this than women do. I don't know.
Oh, really?
I find more men, yes. Well,
maybe they have it like stashed in their homes, and when you finish it, you take it. Is that it?
Some people have said, let's clear one myth as well.
Right.
Maybe, yeah. So people say that when they take it, oh, are you on a contraceptive? Do you know that it will be difficult to give birth? Do you know that you're worrying your womb? Do you know how dangerous it is and all that? I mean, you yourself, what are some of the most, some of the things that you have heard that you're like, really?
Well, okay, just to answer your question on again, it's an individual thing.
Okay.
There are women who are highly fertile. I mean, you go and play around them, tomorrow they are pregnant. There are women, you have to, no matter what you do, it's so difficult for them to get pregnant. So again, it's not because of the contraception. It's because we are different individuals. Because that's why we take it every day. If you miss your combined oral contraceptive pills, people miss it a day or two, and they get pregnant. There are people who miss it and they will still go about their things and come back another day. So because we know that you miss it and you're likely to get pregnant, we say you miss it, take it, because you can't get pregnant. So it's an individual thing. It's not because of the medicine that is making you not come around after. No, it's about the individual. So that does that. I mean, some of the interesting things I have heard, somebody came and said that the oral contraception has made her go crazy. Like, she's now angry at her kids every time, angry at her husband every time. I mean, it was a big deal because she was so sure that this contraception has made her go crazy. So, but sometimes if you've had like 3 kids, you've had a 4th one, there's a lot of stress already. You are under a whole lot of stress. So yes, you may be on contraception, there's estrogen and progesterone there and that sort of thing. But that's again, watch it. Is this your normal thing? Is there something happening that is making you undergo more stress than you usually do on a normal day? Then you can conclude that, okay, this thing is making me. But you have 3 children, you have a new baby, you don't have help, you're the only one, the kids are running around the place, and you are like irritable all the time. And then it's like
something that induces hormones. Isn't it possible?
Yeah, so that's the point I'm trying to make, that be sure that, so first of all, anytime you think that your medication is giving you some side effects, you need to come in. And that's why we don't want to just dish it out without anybody helping with and supporting with it. If you think something is off with you, you come for an assessment. We can look at the facts of it, whether what you're saying is true. And if we think that, well, there may be a case in here, we would withdraw the medications and then put you on something else. There's always another option. That's a good thing about contraception. There's not only one.
Yeah.
There are so many that can be tailored for the individual depending on your needs and things like that. So anytime you feel like there's something off, come in and talk to us. I mean, I think that
is it the fact that if you're on the daily one, the oral one every day, and you missed maybe some days, is it the fact that you go back to it, and you had sex? Is it that you go back to it, or you now are eligible for the emergency one?
Right. So if you miss a day, you can just go back to it. If you miss 3 days, that is like dangerous. Yes. So if you miss a day, well, it's okay. You can just go back to it. But something 3 days and beyond, technically you have just spoiled the flow. So you might as well add maybe a barrier method. You can continue taking it, but you don't depend only on that one. You add a barrier method,
right,
like a condom, and make sure that you complete the cycle and then start all over again. Because missing 3 days can really, like I said, there's people who are like really fertile. So you miss like 3 days and it's like it drops the
Is this a myth or it's also true? Extended benefit of the oral pills. Some you would hear some people say that I was struggling with some acne and all of that. I went to see the doctor, and so first of all, maybe you visit a friend and they're not married, or they're not in a relationship or anything. They have zero reason why they're having sex, and there's oral contraception on their table. They're like, They say, oh, no, it was given to me because of I have acne, this and that. Is this a myth? Is this true?
It's true. It's okay. So because they are hormones, you know, with women, I mean, progestin, estrogen has some effects on our skin, you know. So the progestin one can actually induce the acne and induce hirsutism, what we call like women who have like a lot of hair in their beard and things like that. So excess of it can lead you to getting extra, acne and things like that. So we can manipulate the hormones in the oral contraceptives to be able to correct that. You get it. So they use the effects of the hormones in the oral contraception to correct the acne, because you can use the estrogen effects to correct somebody's high progestin levels that is given the so that is like highly manipulative things that doctors do too. So it's possible that this person may have been telling you some truth, because you know polycystic ovarian syndrome, I don't know if you heard of PCOS.
Yes.
It leads to hirsutism and then excess weight gain and acne and things like that. And then we use these oral contraceptives to manipulate the hormones to correct some of these things. So that so that's a bit of it.
Okay. My final question will be the long-term use of it. Is there ever the beginning and the end for it, or you can take it so long as you want to?
Yes.
The longest you want.
I would say you can take it so long as you want. So as long as you're not doing it by yourself, but you're doing it with a healthcare professional who is advising you along the way. We have contraceptions that go for like 10 years and things like that.
Sounds scary.
So scary?
Sounds scary to me.
Oh no, you can do it.
Can a man take contraceptives? So that it
For now, there are no oral contraceptions on the market for men. So the barrier methods are there for men, and then the vasectomy is also there for men. But currently, we don't have any oral contraceptions. I'm waiting for when we get an oral contraception for men.
This is why I feel like they put the whole responsibility on the woman,
isn't it?
So
What would that mean? What would an oral contraceptive do for a man? It will to kill like
cook the sperm.
Spermicide.
But you know there are spermicides that are
What is
used.
that?
Spermicide, so like just to kill the sperms or make it less mobile.
Okay, so it will come like water like that, but it is dead.
No, the spermicide that we have now are usually topical. So you put it in the vagina before the sexual intercourse.
Yeah, so by the time
once the sperm comes, it makes it, it either kills it or makes it immobile.
Okay.
But it's still for the woman, not for the man.
Exactly. So we are waiting for the time.
Doc, it's the way God made men. And I think that, you know, Doc, on that note, thank you very much. On that note, thank you so much. Thank you for the education.
Yeah, most welcome.
For further inquiries, please, where should we go?
Well, you can check out the Ayawaso West Municipal Assembly's websites. We post a few things here and there every now and then on health. And then you can also visit the Ghana Health Service websites for some of these information.
We love Dr. Louisa.
Always love Dr. Louisa. Always.
Yes, she's a public health physician, specialist, and municipal director for health at Ayawaso West. Thank you so much, Doc. We could have this conversation forever.
Today, what are your predictions? Today we have a match. It's match day.
Is it Ghana and who?
Ghana.
I think Ghana. I like that. I like that so much. We don't know what's happening.
Ghana and Central African Republic.
Who are these?
Okay.
Do you care who you are? So it matters who you are playing, right? Before you can predict.
Who are these people?
But Ghana will win. Ghana will win.
Of course.
2-0.
Of course.
2-0.
I'm saying 3-1. We'll see about it.
Okay. Hey, then
2-0. The odds are over 1.5. Thank you.
Yeah, the Mamo, MX84.
Have a good one, though.
Thank you so much.
All right, guys.
Thank you.
Stay.
The show
It's been a
continues.
pleasure.
Yeah.
All right. More on the show.
Right.